Happy Health Empowered family. Welcome back for another episode of Excuse Me, Doctor. My name is Dr. Melissa Clark, also known as Dr. Mel. Whatever you're comfortable with, just happy that you are tuning in. And if this is your first time tuning in, welcome. Please hit that subscribe button if you're watching on YouTube. If you're on Facebook, please hit that like button. And most importantly, we are here every week doing the same thing, which is bringing you the information and content that you need to make wise health decisions, not just for yourself, but also for your family, your loved ones, and for your whole community. So, strap in, make sure that you put those questions in the chat because we are here to answer them. And in order to do all that we do and create this amazing week that we're going to kick off, I need to have my two incredible co-hosts with me. So, Larisha Harris, Wayne Bruce, where y'all at?
Right here, Dr. Mel. Hey, Dr. Mel.
Yes.
I got something real quick. Look, the audio wasn't right for the intro of your show.
Uh-huh.
So I think we should do the intro again. What you think, Larisha?
If that's the way you feel, Wayne, you
that's
run
the way I
the,
feel. It's 20
you
seconds,
run the
y'all.
background.
Okay.
I just think you're a fan of the music. That's all.
Yeah, he is. And it's great music. And I'm glad y'all here. How are y'all doing?
Great. How are you doing?
Fantastic. I'm looking forward to y'all bringing in the word from the street and all that great
Larisha looks
stuff.
nice and tan, like she's and relaxed and everything.
I know, like she's been on vacation or something.
Like she's been on vacation.
I have, and I am very relaxed and very tanned. So thank you for noticing.
I mean, it sounds like some people have all the fun.
I'm telling you. Well, what are we talking about today, y'all? What is today's topic? Big topic.
The cautions of cosmetic surgery. So many men are having these surgeries. These well, maybe not men, but I'll let Larisha talk about it.
We're talking about avoiding the hidden dangers of plastic surgery. We've seen recently Jacky Oh. A lot of people also know about the mother of Kanye West, Donda West. Those are just a few high-profile individuals who, have died from complications of plastic surgery. So we have two great guests who will be joining you, Dr. Mel, to have a conversation about some of these hidden dangers. And I think a lot of people need to know because plastic surgery has been a common factor in our society today.
Yeah, it's getting more and more common. And I think the key we're really going to explore is when it's safely done and done by qualified surgeons in a regulated environment is safe. But there's a whole lot of stuff going on. It's almost like the Wild Wild West out there when it comes to cosmetic procedures. And so that's what our guests are going to talk to us about and how to, if you're thinking about it, get it done safely and what some of the things are that you should be thinking about specifically. So we're going to go there. It's going to be a really great show. So make sure that you share. If you are thinking about it, getting cosmetic surgery, if anybody is thinking about it, make sure you share it with them because it's going to be a wonderful show. So,
well, I know it's big now with men getting cosmetic surgery, especially after weight loss and things like that. So, yeah. I mean, I'm only joking just to have fun because that's what I do here.
Did somebody pull you up in the chat?
No, not yet, but I know it's coming.
It's coming.
I know it's coming.
Good. As well they should.
We had an intern put out what you don't know about plastic surgery could kill you. And we had to pull that down. Because it wasn't that type. It was, we don't go for sensationalism here. So
right. We're gonna present to you things that you need to be empowered when it comes to your health decisions. Right. That's what we do. And to that end, let's hit that weekly recap.
Okay, let's go to the weekly recap. Everything you need to know in health and wellness in the past week. So, Dr. Mel, diet foods, I take this personally. Diet foods, since I've lost 30 something pounds.
And
We not going to count though. I take this diet foods thing. Are they worth it?
So the World Health Organization came out and said that there was little evidence to suggest that artificial sweeteners, which includes aspartame, that's the stuff that's in Equal and some other ones, that actually helps you lose weight or reduce body fat. And it actually might increase your risk for type 2 diabetes and heart problems, right? So definitely no reason to use it. Now there's been another thing added to that cautionary tale, which is large amounts of aspartame may increase the risk of cancer.
Wow.
So
there goes my Diet Cokes, huh?
And you might be asking, well, what are large amounts? So that's
what are large amounts, Dr. Mel?
40 milligrams per kilogram of body weight. So therefore it's less riskier for kids, it's more riskier for kids because they would, more aspartame per body weight is dangerous, right? Mm-hmm. And so even if you're a casual consumer, though, there's enough evidence to say, step away from the aspartame, step away from the Equal. It's not worth it because it seems like there are too many risks associated with it. And it's also important to read labels because it might be hidden in your, in whatever sort of diet food that you're eating.
Mm-hmm. Well, so even as the WHO, who says not to worry if you're a casual consumer, you have to ask yourself, is it helping me lose weight, or am I causing myself a greater consequence with the aspartame, right?
Right, with the diabetes and the heart disease and the cancer and all that other stuff.
So I can't have no more Diet Cokes, no Coke Zeros.
I don't think it's a good idea. That's my
Coke
personal
Zeros.
opinion. Yeah, backed
they
up by
even came
science.
out with a Diet Sprite now.
I don't drink any of those.
Okay.
Yeah, water is the best drink of all. I'm just saying.
And that's an adequate segue.
It is an adequate segue because the question now is, Dr. Mel, is it time to tap out on tap water? Because as a person who was raised in the South, tap water was our friend when we were outside playing. You go outside, turn on the faucet, and hey, you're refreshed and you keep playing outside. But is it now time to let that go?
Well, there are these things called forever chemicals, or polyfluorinated substances, PFAs. And they're called forever chemicals because they stick around in your body, and unfortunately they can cause cancer and other health problems. They're found in everything from nonstick pans to food packaging. All kinds of products contain them, and what's happened is they've now leaked into our water supply. And so they've seen that drinking water from almost half of faucets in the United States contain these PFAs, or forever chemicals. And so, they're being dumped into public wastewater without being policed to see how, which companies are dumping them and how many quantities. There's no limit on it. So that's what the real issue is with tap water.
So are there specific areas where these places or these chemicals have tested, positive greater than others or than different areas?
Yeah, so it's least in rural areas, but rural areas aren't exempt. The highest concentrations were in East Coast cities, Great Lakes, the Great Plains cities, urban centers, and then Central and Southern California. So those were it's kind of like everywhere, right? So that's what you have to be careful of. Installing filters on your taps, if you want to continue to drink tap water, which the filters that have been found to be safest are the ones that contain activated charcoal that helps to remove those chemicals out of the water for you to continue to drink safely from the tap.
Oh, wow. So filters for everything now.
Filters
Yes.
for everything. You better have a filter in your house on
Yes.
something.
So it's not just the filters on your Instagram photos. It's also filters on your tab. Just saying.
You're going to destroy a lot of young women with that. I'm going to let Larisha handle the next one. I'm not even going to go there.
Okay, so moving on from filters now, what do we need to know about OPL, right? This is something that was recently discussed. We're all pertaining to birth control. So what do we need to know about this, Dr. Mill?
So recently, the U.S. Food and Drug Administration approved the first over-the-counter birth control pill called the O pill. And it uses only the hormone progestin, as opposed to some birth control pills use both estrogen and progesterone. And so the good thing about that is by leaving the estrogen out, it reduces the risk of some of the harmful effects of prior birth control pills, which are things like high blood pressure or higher risk of blood clots. The main precaution is if you've had breast cancer or have breast cancer, you should avoid it because that can, lead to a recurrence or worsening or making it more difficult to treat your breast cancer.
But what if you are unaware as to whether or not, you are a person who could potentially, have breast cancer? Is that something to take into consideration as well?
Well, I think if you have a family history, it probably, especially a strong family history, like in your mother, or that you have the genetic predisposition for breast cancer in your family, definitely something you should talk over with your doctor. If you already have the diagnosis, of course, you should definitely avoid taking the birth control pill, either the progestin only or the estrogen and progestin type.
So are there any other side effects, whether positive or negative, that we should be aware of as it pertains to this O pill?
Well, I think the most important thing is in this sort of environment where, abortions are becoming outlawed and restricted in many states, that having the availability of an over the counter birth control pill may help to prevent unintended pregnancies. I think that's the biggest positive related to this development. It can give women a more reproductive control over their own health. And it won't be
And,
available till 2024. Just want to say that.
and that was my next question.
Yes. So that's it.
And there you have it. Keep it in line with that and just the subject matter tonight. And Larisha is here. We have to go to her segment, y'all. And her segment is
What y'all think? All right.
So the what y'all think tonight is this. Do Black people need to be worried about skin cancer? Dr. Mel?
Yes.
That's what
and why do you say that, Larisha? Because Larisha just answered for y'all, but put it in the chat.
For the entire race.
What you think in the chat?
She answered for everybody, Dr. Mel.
Yes.
One, because we are not invincible. One. Two, I have an uncle who actually passed away from skin cancer. It was something that he developed at I don't want to say an early age, but he was still very young when he developed skin cancer. And so I understand that it's possible and it's likely to happen for African American men and women. So that's why I say yes.
Well, that's an excellent reason, and my condolences about your uncle.
Yes.
We also know the famous Bob Marley as well passed away from skin cancer.
Yes.
And it turns out there was a study that was just published that shows that even though white men are more likely to get skin cancer, Black men have a 26% higher risk of death from skin cancer as compared to whites. And, some of it has to do with access to care, whether Black men seek care when something is wrong, or even realizing that something is wrong. not thinking that it might be something serious when they see a discoloration or something on their toe or the bottom of their foot. So, that's actually, those are two of the more common places where skin cancer in African Americans occurs or in Black people occurs. And it's really important to advocate for yourself, even if the doctor that you go to kind of blows it off. If you see some sort of discoloration that's growing, that you advocate for yourself, go to a board certified dermatologist if you see any skin changes anywhere on your body that seem out of place and seem to be worsening over time.
So remember, put it in the chat what you think.
Yes. Even though we
because
kind of answered it for you.
we
but
kind of
yeah.
answered for the entire race. We did. Bob Marley forever.
Well, on that note,
I mean, come on.
Thank
man.
you all. Thank you all for walking through the recap and the what y'all think. And now we're going to see y'all a little bit later, because we are going to go into the main reason we're here tonight, which is to talk about the hidden concerns around plastic surgery, what you should know. So there was a large research study done, a review of like 900 research papers that show that people are treated differently based upon how physically attractive they're perceived to be. And, you probably didn't need to go to the scientific literature to know that. We know, though, that this is a major motivator for people choosing to undergo cosmetic surgery procedures. But recently, there have been some disturbing industry trends. And we're going to talk about those tonight. And we're going to talk about what's attractive, who decides that, what are the dangers of certain plastic surgery procedures, and how do you become a savvy consumer if you're going to have a plastic surgery procedure? So to talk about that, we have two fantastic guests. The first is Quintessa Williams. She is a writer and journalist with work featured in Madame Noir, The Root, Zora, among others. She's also a content editor for Writers and Editors of Color, which is an online international collective for BIPOC writers and editors. Thank you so much for joining us, Quintessa. All right. And also, we have Dr. Paul Thesiger, who's a board-certified plastic and reconstructive surgeon, whose goal is to deliver safe, top-quality aesthetic and reconstructive services to patients in the DC metropolitan area. Dr. Thesiger, thank you so much for being here tonight.
Thanks for having me.
All right. Well, let's start off with Quintessa. We need to make sure that she is not on mute. And Quintessa, you wrote an article, The Hidden Dangers of Cosmetic Surgery Highlights the Death Sentence Over Black Women. Very strong title there. And it describes some of the changing trends that we're seeing with Black women getting plastic surgery. How have the numbers been changing over time?
As we know now, cosmetic surgeries have been on a consistent rise in our community for the past decade. Since 2010, the American Society of Plastic Surgeons have reported that over 1 million African Americans underwent some form of cosmetic surgery. And those numbers represent about 8% of the total 13% African American population. So we're talking about over half the population, African American population, excuse me, and we're talking about it now from a more consistent base as the numbers rise each year.
So you mean really we're 13% of the population, and about 8% of the total amount of plastic surgery is with Black consumers. So why do you think that Black women are seeking out plastic surgery more? And I think you explored some of these things in your article.
Absolutely. I definitely think the reasons have increased over time, but I think increased access is a major key factor in the uprising. Black women account for a large consumer base. We make considerable contributions to the overall economy. So I think that with the media and the internet playing a more significant role in making cosmetic treatment available and more acceptable, our buying power has had a greater impact, whether we previously shunned the idea or not. It's so much about having access to a product that was once only inclusive to a particular demographic. And now these industries are aware of our buying power. So I'd have to say increased access for sure.
So it sounds like increased access and perhaps increased marketing as well.
Absolutely.
And
also, oh, go ahead.
No, go ahead.
I was just going to add that Black women are on the rise more publicly and professionally. And, you know, we're finding new ways to enhance ourselves in a manner that's deemed acceptable. So I think that buying into the societal standards and knowing that we are in these public settings is kind of a factor as well.
Right. Which kind of goes into, you know, who decides what's attractive, right? Which I think is one of the other ideas that you raised in terms of what are societal standards of beauty and who says what looks attractive versus not.
Absolutely.
Yeah. So Dr. Thesiger, would love to bring you in on the discussion. So, you know, first of all, I want to start off by saying you're a board certified plastic surgery surgeon. Please tell us, what does that mean? And what is the rigorous training that you had to go through to be able to say that you're a board certified plastic surgeon?
So in order to train in plastic surgery, at least 10, 15 years ago, you still had to do a full residency in general surgery. Once that was done, you did a fellowship in plastic surgery for an extra 2 or 3 years. And then you had to sit the boards, which were comprised of both the oral boards as well as the written boards. And only when you passed both could you call yourself board certified.
And so just to interject the time frame in mind. So 4 years of college, 4 years of medical school, 5 years of a plastic surgery, of a general surgery residency, 2 years of plastic surgery, and then those exams.
Exactly. But they've shortened it now where most of the training programs are 3 years of plastics and 3 years of general surgery. So you do 3 years of general first, and then you do 3 years of plastics, and then you can take your tests. So
a total of 6 years.
It's still a long time. As a result, a lot of the people you see out there calling themselves cosmetic surgeons are not actually plastic surgeons. That's the first thing I wanted to kind of put out there. There's a lot. We're not going to have enough time tonight to go into everything, but that's the first thing. There are a lot of people who call themselves cosmetic surgeons or cosmetic physicians, and they're not even surgeons. They've never even trained in surgery. And the public has no way of knowing this unless they know how to look at someone's credentials.
Right.
So that's kind of unfortunate. So
that's the first thing that we want to bring out, that there is such a thing as board certified plastic surgeons who've trained an enormous amount of time to do plastic surgery procedures, but there are other people out here who are also doing them who don't have that same degree of training.
Absolutely.
So in your experience, you know, I asked Quintessa about reasons people have plastic surgery. What are some of the reasons that you have seen that people are choosing to have plastic surgery, and what are some of the more common ones in your practice, procedures specifically?
The majority of the patients are women. Women are.
So Wayne was right.
Yeah. Many women are under immense pressure to maintain a certain look, both professionally as well as socially. And it's a pressure, in my view, that they place on themselves, amongst themselves, more so than pressure from males. Now, I know that's a controversial comment, but that's 20 plus years experience doing this. So it's more of a competitive pressure in and among women than it is from men per se. And as a result, very often you see spouses, significant others, friends who are male telling their female friends or partners not to do anything. But it's their female friends and frenemies, because that's a word, that tell them that they should do it because they're looking sorry or they're going downhill or what have you. It's a whole different kettle of fish. I'm not sure how much we're going to go into that tonight, but after 20 years, it's kind of a little bit distressing for me to see what goes on. On a positive note, who decides what's beautiful? About 5 years ago, Beyonce Knowles took the crown, or the, as it were, as being the definition of beauty for both African American as well as non-African American women. And I never thought I would see the day that that would happen. So it was kind of a bittersweet moment. So a Black woman or a woman of color was at that time to be considered the most beautiful woman on the planet. And the following that she had and the way she looked, the shape of her body and everything, including Jennifer Lopez. I have to include Jennifer. Let's not talk about Kim Kardashian, including Jennifer Lopez. They kind of set the standard of what a lot of women aspired their body to look like anyway, at least their body.
And what is your source for that? You know, for those women that you mentioned by name.
So again, it's anecdotal for me. Of course, I'm just giving my opinion, and it's based on the requests or the descriptions that women use when they're private,
when they describe
in the clinic, and they say, "You know how so and so has such and such a look."
Got it.
And those two women are usually the most mentioned ones of the ideal body shape that many women of color and non-color not women of color aspire towards. And for the first time ever, the curvaceous hips and the rear end and so forth, the so-called Brazilian buttlet, that became like the ideal for a lot of women in this country and around the world.
So then that goes to the second question. What are some of the more common procedures that are requested that you see women coming in?
Yeah, liposuction leads the way. Most women who've had children like to have a tummy tuck, a nice flat, tight stomach. And then, of course, the notorious BBL, which is the Brazilian butt lift, which is the introduction of the fat into the gluteal area to enhance the shape of the gluteal area. Right. It's highly controversial. It began, of course, in Brazil. That's why it's called the Brazilian butt lift. It expanded down in Miami from some of the same people that I trained under, fortunately or unfortunately, and it has now become a notorious procedure. I do it, but I do it conservatively, and I pick my clients very carefully. But that's a whole nother kettle of fish. Again, I don't want to go off on a tangent. If you want to ask about Brazilian,
well, actually, that is the next question I was going to ask you: is how do you prepare your patients for those procedures that they come in asking for, to try to understand, are they ready psychologically and physically for these procedures?
So I'm very proud to say on the show that we actually have a complete program now. We have emotional support, nutritional support, physical support, and recovery, as well as my counsel that I give to them. It took me about 20 years to develop this. We have a nutrition plan where we try to get the patient started on green smoothies to get the body alkaline, and it gets the body ready for the stress and trauma of the surgery. My nutritionist also takes them through the emotional swings that they're going to probably experience as they go through this process. My counsel helps them as well to decide what's the best procedure for them. And I do try to talk some people down and away from some of the more extreme things that they come in saying that they want. And then for recovery, we have continued nutrition support. We have massage therapy that is mobile, that actually comes to the house. And of course, they have full access to me by way of my cell phone, email, what have you. I'm one of those kind of crazy doctors who gives my cell phone out to my patients. And a lot of people think that it's just crazy, but it works for me, and it has worked for the last almost 20 years. And, so patients feel connected with us as a clinic and with me.
Right.
Sure. That segues into the whole chop shop thing down in Miami and all of that. And I don't know if you're going to ask that question. Yeah.
Well, let's go back to Quintessa for a moment. You know, you raised some of the concerns in ways in which race intersects with the higher death rates following any kind of surgery, including cosmetic surgery. Can you talk about that a little bit, and then that'll segue us into the chop shops,
Absolutely.
as Dr. Thesiger called them? Yeah.
Absolutely. Well, as we may know, Black women already account for several cases of mortality across the board in the health industry. You know, the cosmetic industry is no different. I think what makes the disproportionate coverage on Black women in cosmetic surgery more unique is the assumption that because patients opt in to cosmetic surgery as a choice rather than a necessity, there's this assumption that they've been already pre-consulted and informed about everything. And if not, they should have, they're still expected to have known what could have been done differently to prevent their own injury or death. And so in this case, the surgeon who is guilty of malpractice gets more of the benefit of the doubt, more than the Black woman who was the victim of malpractice. And so it's that notion that unfortunately allows such malpractice to continue.
And you know, we talked about at the beginning, you know, some prominent cases of people dying after plastic surgery. Certainly it's happened to the two celebrities that were mentioned, but much more commonly, you know, among you know, non-celebrities, obviously. And I think that's a little bit about what you were getting at in your article. So Dr. Thesiger, when you talk about chop shops, can you relate those two things in terms of, you know, what's happening when Black women go to non-board certified plastic surgeons, and how they may or may not be informed of the dangers or the concerns that anybody should have when getting a surgical procedure?
Mm-hmm. Plastic surgery has become a commodity. That's the first problem. It's no longer a medical service per se. It has become a commodity, such as a product, and products tend to be traded. They tend to be bargained over. They tend to be sold, traded, bought, and so forth. That's number one problem. Because there's so much money to be made in this industry, unscrupulous practices have emerged. And one of the unscrupulous practices is the action of so-called itinerant surgery. And what is that? Itinerant surgery means you meet your surgeon right before the operation. When we were in training 25 years ago, that was considered unethical. But that was definitely unethical for someone who was physically sick, such as a cancer patient, unless it's an emergency, a gunshot wound, a blockage or something. You should consult with your doctor before and make a plan and so on. In the cosmetic world, it's not technically considered unethical to perform itinerant surgery. Once that ethical veil was lifted, it just exploded. So you have a lot of these clinics now where they do everything online in terms of their orientation and so-called informed consent, very often not involving the doctor, but just a nurse coordinator, which is fine technically. But the patient doesn't actually meet the doctor until they're ready to go in the room. That's what's called an itinerant surgery practice. And once the surgery is over, that patient may never see that doctor again, or maybe just see them once for one follow-up, and that's it. And after that, the rest of the follow-up. That is considered to be a breach of the standard of care under the guidelines of the American Board of Surgery and Plastic Surgery. But it's in the cosmetic world, it's kind of an anything goes. And that's what's going on in a lot of these places in Miami. And the person actually doing the surgery is not the surgeon who the person met right before the surgery. That's the other thing. The person actually doing it, maybe a technician or a trainee, and not the actual surgeon who has the experience to do the operation.
Right. And it's not just Miami, it's Mexico, it's the Philippines, it's South America. Not to say that there aren't very qualified surgeons there, but I think what you're getting at is the whole piece of the informed consent,
industry.
developing, yeah, it's an industry, and they're bypassing some of these crucial steps. And a lot of it is in the name of money and saving money, right?
Well, not saving money, making the patient is trying to save money.
Right, exactly. That's what I mean. Yeah.
But those type of clinics, they mint. I mean, the kind of gross revenue, I've seen these things, and with the kind of gross revenues they pull in, sometimes they're 10 times higher than what a private person would make in his own clinic, because it's literally a factory. They're going from morning to night, just cranking them out. And now, that said, a lot of women of color, especially African-American women, they're looking for the best price they can get. And bargain shopping tends to occur. And even though they know that when you're going really low on your pricing, your quality is probably suffering, they still do it for some reason. And it's a very painful topic for me in particular. Very painful.
Quintessa, why do you think that, just your opinion, obviously, why do you think that that's happening in terms of, even though, people generally know you get what you pay for, but yet there's this influx or large amounts of people opting for the cheapest plastic surgery they can get?
I think going back to what we initially talked about in terms of societal standards, I think because societal standards are at such a high, all-time high for us, and I think because we are more visible in public spaces, such as in the workplace and being shown on television, I think that it's us seeking to fulfill a level of acceptance. The more visible we are in public settings, it's kind of similar to the discourse on with the hair dilemma in the workplace. Having that stigma around, your hair should look a certain way in order for you to be accepted or promoted. So I think it's a result of Black women wanting to fulfill that level of acceptance.
Got it. So given all this, what is some of the due diligence that women should be doing regarding choosing a plastic surgery practice? Dr. Thesiger?
So for women or men, anybody who's confused about the certification status or the training of a doctor, when you look at their bio, you should see on there where they trained in general surgery or plastic surgery. If you don't see that on the bio, that means more than likely they never did it. I'll say that again. When you look at the bio of the doctor, because a lot of doctors have these long, very involved, beautiful bios about all the things they did and how wonderful they are. But if you don't see a line there where they spent 3, 4, 5 years training in general and plastic surgery, 5 to 8 years, it probably means they never did it. And they're just hiding that fact with all the other line items that they have on their bio. Whether or not they're certified should be also indicated on their website or on their letterhead or whatever, the Instagram, Facebook, what have you. But it is even more important to make sure they actually trained in surgery. I cannot say that enough. A lot of people have certified, but there are a lot of different boards out there. There's a cosmetic board and this board and that. But if you don't see a training in surgery, general or plastic surgery, that means they are not a plastic surgeon. Punto.
And then when they're choosing a practice, you mentioned some of the things that you advise on both before the operation and after the operation. If you were to choose, 3 or 4 things that, are really crucial that women and men should be looking for in terms of the sort of hand holding through the process, what would you say those are?
I would say make sure the clinic is organized, that they have a system in place for dealing with patients. Make sure that the professionals are reachable, either through the office or personally. There are not that many people who, like me, give out their cell phone. I don't expect all the doctors to give out a cell phone. That's unusual. But you should at least be able to reach them, because you know that that's going to be your support line once the surgery is complete. And just in general, when you go in there, what's the vibe? Do you feel welcome? Is the place clean? Is it neat? Is it well presented? Does the doctor respond to your needs if you try to get in touch with him or her? Or do they blow you off? If they're blowing you off before the surgery, they're definitely going to blow you off when the surgery is over, okay? Because as big as my heart is and as much pain as I'm willing to tolerate in terms of problems and so on after surgery, it is hard to answer those calls a lot of times. So if somebody's blowing you off before the surgery, they're not going to pay attention to you when it's over, because that's when the problems begin for a lot of people. So they should have a system. Nutrition is important. How do they treat you when you have a concern? And if you have multiple questions, if you're one of those nervous people who have a million questions before the surgery, do they blow you off, or does somebody respond to them? Those are key things to look for.
Great. And I can't believe it's time already to bring back in Larissa and Wayne to see if we have any questions in the chat for either Quintessa or Dr. Thesiger. Hey, y'all. What's it looking like out there?
Hey. Most people are just having comments, but we do have a question from Valerie Spalding Parker. When you mentioned chop shops, how are they allowed to get away with what they get away with?
Okay. All right, here we go. I'm going to take a deep breath. First of all, I trained in Miami, so I don't have a bone to pick. I love Miami. In fact, I wanted to stay in Miami. Right? Anybody who's lived down there would know why. It's kind of like an ongoing discotheque every day. I trained at the University of Miami with Seth Thaler and some of the best plastic surgeons in this country. Tony Wolf, Seth Thaler, Milton Armstrong. But because of the nature of the business model that they use down there, it's just incredible. The attraction of the making of the money and so on. They have a lot of power. When I say they, the doctors and business interests in Florida. And Florida is a very business-friendly state. And so even though they have so many problems with patients getting sick and dying, they just simply meet with the board. And I don't know what goes on behind closed doors, but they're allowed to keep going. They do make some modifications, but other than that, very few of them have been shut down. They just keep operating. It's pretty amazing. But that's Florida. That's, I won't say anymore.
So it's the business interest superseding the safety of the patient.
Oh, absolutely. Totally. Yeah. Let me give you some figures here. Okay, are you ready? Are we live? We're in live TV. Some of these places are pulling in $150,000 a day.
Wow. Yeah.
Do I need to say any more?
Yeah.
That is why, with that kind of income.
Yeah. So they can lobby. They pay their
lobby.
Large share of taxes, etc. I got it.
Yes.
Okay.
Yeah. That's the kind of revenue we're talking about here.
Wow.
I think that's worth me being interested in a new career. Is it too late?
And that is the kind.
It is way too late.
Those kind of, for the ultra rich, those kind of numbers are not impressive. But for the average person, those kind of numbers are eye popping. And unfortunately, they make people do things that they normally wouldn't do, and
that they're unqualified to do.
Exactly. And that's a whole nother kettle of fish too.
And then any other questions from the chat?
I just have a question for Quintessa and Dr. T. You can chime in on this as well. But you talked about the societal pressures that Black women, often deal with. And what came to mind when you were talking about that was simply the simple thought of self-esteem. How do we combat those societal pressures and also really dig in or key in on that root, which ultimately, to me, in my opinion, boils down to a person's self-esteem?
Yeah, I think the biggest thing for us to realize is that the societal standards placed before us are very unrealistic. I think that when we go into these public settings, we want to make sure that we're showing up as our best selves, but I think society places them at an unrealistic rate, and so we are kind of forced to navigate a society where we have to try to show up as what we think is our best selves and try to culturally feel accepted in these public settings as well. So I think the biggest thing is realizing that the societal standards that often lead Black women into undergoing surgery is realizing that the standards are very unrealistic.
And I think too, we haven't specifically said the role of social media. I mean, I think sort of the magnification of what people think is beautiful happens through social media now on a much, much larger scale than it ever has before, which adds to the pressure that starts with young people starting to access social media at early and earlier ages. And, you know, a lot of that concept of beauty and what is acceptable or desirable gets magnified, you know, starting at an earlier and earlier age.
Yeah. And they tell people, you know, here it is right in front of you. You have access to this now. So it kind of, like Dr. Clark said, it magnifies it for sure.
Mm-hmm.
I think that in many ways, I'm sorry, go ahead.
Go ahead.
We mentioned social media, we mentioned, you know, the people who are in the public eye and stars, you know, the politicians, these people also play a role. And that's why I think, for example, Michelle Obama, just by being who she is and the way she presented herself, and I think even after she left the White House for a while, she was wearing her hair naturally and so on. I can't emphasize enough how that does also move the needle a little bit for women.
Yeah.
We all know about the movie Black Panther. How, I mean, I'm very rarely at a loss for words, but I was at a loss for words in both number one and the sequel at just how stunningly beautiful all of the women were, not just Angela Bassett, but the warriors and their looks and their costumes. And I mean, things like this are important. So the directors of film, people who are in the industry in Hollywood and what they project, that's important as well. And shows like this are important. I should probably say Black women are stunning. They are beautiful. They are breathtaking. In fact, like Black Panther 2, when Lupita turned around by the ocean there in her outfit, I couldn't breathe. I was stuck.
And are these some of the things that you use to prepare your plastic surgery patients in terms of expectations?
No, see, I am actually one of those people who downplays. So whenever somebody comes, I'm not one of those doctors, oh, you need to do this, that, and the other. I help. That's my basic greeting. In what way can I serve you? If I'm speaking in Spanish, I'm saying, ¿Qué puedo servirles? How do I help you? And I let them tell me what bothers them. And then I try to downplay it as much as possible in terms of it being a problem in their life. Because not only because I believe in that philosophy, but if you don't reduce that level of anxiety, it only increases if they decide to actually do something and you decide to operate on it. So I'm very holistic when it comes to the body. I don't dye my hair. I'm bald. I grew a beard when I went bald. I've never had any work. I've never had any Botox. I'm not one of those guys who's going to inject himself with stuff. I think you look your best if you go with your natural look and try to optimize whatever you have naturally. So that's just my philosophy.
I have another question. We have a question coming from Rhoda Lawrence, and she asked us, oh, hold on. That's not the Rhoda Lawrence question. Rhoda Lawrence asks, people like Madonna are attacked for surgery and people like Vanessa Williams are attacked for aging. Is there a certain age group that's more likely to have surgery?
Yes, there is, definitely. women of childbearing, just beyond childbearing, so right after they've finished their children, so usually early 40s, late 30s, early 40s. I'm Jamaican, by the way, that's why I said 40. So women who are just had kids, they are much more likely to come in as your young patient. And then there's another gap, and then women coming up to retirement age or just beyond retirement age who want to try to kind of get a refresher, as it were. That's the second wave. You have fewer women coming in their 50s. It's very interesting. So the 50s is like a gap. So you have late 30s, early 40s, and then 60 and above. So that's usually what we see. Madonna looks awful. I'm sorry. This is a live show. Madonna was she was stunningly beautiful before. I'm not sure what happened. But I'm just gonna be blunt. She looks awful. And I'm hoping and praying.
Your opinions of the guests don't necessarily reflect those of producers of Excuse Me, Doctor.
Listen,
are definitely
I think anyone who would doesn't want to get a sugar coat on things. And she is a beautiful woman who I think made her brand on shocking people, and I think she's taken it to that level of extremity. I don't think you could possibly look at how she presented herself at that last awards show and say anything other than this is an epitome of this plastic surgery thing gone awry, right?
Right. And what you were saying about the women after 40 or after their childbearing years, there's actually a procedure called a mommy makeover, right?
There is.
Which I think is
we do. Yeah.
So
that's a tummy tuck and a breast lift, and we do the curves and all of that stuff. It's a lot of work, but you can really transform the body into, restore it to the pre-childbearing phase, as it were.
Yeah.
We have another question, and this one pertains to breast implants and BBLs also. The question is, do those last forever, or do they need to be redone after a certain period of time, especially as people age and their bodies change?
So breast implants, silicone breast implants by the Mental Corporation, which is the most commonly used implant now in the United States, the best and oldest company, they carry lifetime warranties. So they don't actually have to be redone every 10 years. A lot of doctors tell their patients that. It's actually not true. If you don't mind keeping your implants in and you don't have any problems, you can keep them for your life. Most people like to change them just because they want to feel as if they have a new prosthetic, a newer or the latest technology as their prosthetic if they keep it. Okay. So that's with regards to breast implants. BBLs and fat injections and so forth, 50% of the fat dissolves away, 50% of it sticks around. You would be shocked to know how many women who are Latin or of Mayan ancestry or Aztec who are trying to have butts like African women or Black women. And it just doesn't work for them genetically. So you can inject all the fat you want, and it's usually not going to give you the shape that you want. So it's rare that you would want to touch up a BBL, but some people do come for second rounds and so on. And that's a whole nother topic, which I'm probably not going to get into because I don't agree with it, and of course it's an opinion show, but I think if you do that operation, fine, but I don't think it's something you should go back and keep doing again and again. It's too dangerous.
It is. And Quintessa, a quick question for you. In your article, you raised the issue on the lack of competence industry-wide in enhancing non-Caucasian features, which, ties in a little bit to what Dr. T just talked about. Can you elaborate on that?
Absolutely. So when it comes, like we just talked about BBLs, when it comes to those type of cosmetic surgeries, what is often required to perform those surgeries can inadvertently cause death and injury. And I know with the BBL, a lot of patients are unaware of and maybe Dr. Thesiger can expand upon it better than I can, but I know that it requires a constant insertion under the skin in order to move the fat in the preferred area. So a lot of patients go in not knowing that. And along with that, they may have underlying chronic conditions
Mhm.
left unknown or unaddressed, and that unawareness speaks to another reality in a whole nother health setting where they may have not been informed that they had such, potential risk in undergoing these procedures. And I also talked about the story with the reality star K. Michelle. She underwent and did the BBL, and she actually did go back and get fillers, and she kept going back and getting different type of things done in that area. And then she started to experience leg pain, migraines, all types of symptoms. And then she found out she had lupus at the same time.
Wow.
Well, lupus is common in African American women. So you have someone who has a common condition for African American women undergoing one of the most dangerous surgeries. And I think, I don't think, I know that those things had a dangerous effect on each other. So it was inflammation, double inflammation inside of her body. And she had no idea that she had lupus until she started to really get down to what was going on with her and why this the silicone in her body had spread throughout her body. But
Wow.
it's things like that that make cultural competence more evident and required when you look at it from that lens. When you think about the underlying chronic conditions, when you think about lack of competent care, all of those things become required looking at it through that lens. So.
And I know we're running out of time. I just
wrap.
wanted to ask, we need to wrap up, but I just wanted to mention that in the DC area, there's one of the largest concentrations of African American plastic surgeons. You talk about cultural competence. Of course, it's not a given that people will have that cultural competence, but it's more likely that you will have cultural competence, especially from an African American perspective. So I just wanted to add that in there. I want to thank you all for coming on, Dr. Thesiger, Dr. Paul Thesiger, Quintessa Williams. Thank you all. Fantastic information. Of course, my co-host, Larisha and Wayne. Thanks for bringing the word from the street and for walking us through the recap. And what y'all think? I don't know if we have anything in the chat from the what y'all think. Any
I
comments?
think we answered it, Dr. Mel.
Okay, yeah, I think we answered it. And so thank you all for being here. And before I go, I definitely have to remind my Be Health Empowered audience about that research study. It's still ongoing. They're still looking for individuals who want to talk about their experiences during COVID. It's 2 surveys that you would take as a part of this research study, and you get reimbursed $100 for your time for doing both surveys. If you have any interest whatsoever, please make sure you reach out to Dana Harvey. She can answer all your questions, send you the link for the study, and get you enrolled. Her email is danaharveyresearch@gmail.com. That's Dana, D-A-N-A, Harvey, H-A-R-V-E-Y, research@gmail.com. That is it for us. So glad that you joined in. I didn't thank you all, my audience, for those fantastic questions and everything you put in the chat. Until I see you next time, remember, be wise, be well, and be health empowered. Thanks for joining.
So I guess I should thank the Robinsons. They invited me. They still don't know. I hooked up with Dave 3 days ago. He'll start coughing tomorrow. And I bet in 10 days he'll be on a ventilator. Now his wife, she's not vaccinated because she thinks it'll prevent her from being pregnant. But what they don't know is that I can decrease sperm count. Sorry, Dave. Good luck with that.